Welcome to The Explainer. Today, we're going to talk about some surprisingly simple tools that are used to predict the future. And I mean our collective future, everything from how a company can actually afford your pension to how we track and fight diseases.
So, let's kick things off with a pretty huge question. Think about a pension. It's a promise, right? A promise of income that could last for decades, maybe 20, 30, even 40 years. How on earth can a company calculate the cost of a promise that stretches that far into the future?
Well, the real problem, of course, is uncertainty. I mean, life is messy. It's not a straight line. Over the years, all sorts of things happen. People switch to a new job. They might become disabled. They might decide to retire early, or maybe late. Or, sadly, they might pass away before they even get there. And every single one of those events totally changes the math.
So, to bring a little bit of order to all that chaos, the experts in risk, they're called actuaries, use this really elegant tool called a multiple decrement table. I know, it sounds super complicated, but the idea behind it is actually pretty simple. It's just a way to watch a group of people over time and keep track of all the different reasons they might leave that group. Let's dig into how it actually works. Building one of these things follows a really logical step-by-step process. You decide on your group and the reasons they might leave. You start with an initial number of people, and then year by year, you just calculate how many people leave and update the total. So let's walk through it right now with a nice, simple example.
Okay, let's picture a pension plan. We're going to start with a group, this is called a radix, by the way, of 100,000 employees, and they're all turning 60. For this example, we just want to track 2 ways they can leave the active workforce, either through death or by retiring.
All right, in that first year, between age 60 and 61, we look at historical data to figure out the odds. Let's say we expect about 1% of the group to pass away. That's 1,000 people. And maybe we expect 20% to retire. So that's another 20,000. That means in total, 21,000 people leave the group. Pretty simple math. That leaves 79,000 people who are now entering age 61.
And then you just do it all over again for age 61. Now here's what's really interesting. Even if the probabilities of dying or retiring actually go up as people get older, the total number of people leaving is smaller. It's 20,698, and that's just because our starting pool of people is smaller now.
So we run the numbers one more time for age 62, and look at that. After just 3 years, you can see exactly how our initial group of 100,000 has shrunk all the way down to just under 40,000. We now have this clear year-by-year map of who is expected to still be in the plan.
Okay, so we've built our model. Now for the fun part. Let's put it to work. Let's see what this table can tell us about the actual money involved. Let's say the company has promised every single person who retires a pension of $24,000 a year for the rest of their life. So how do we figure out the total cost of that promise?
Now here's the crucial thing to remember. A dollar that someone gets paid 20 years from now is worth less than a dollar in your pocket today, right? So what we really need is a single number that represents the value of all those potential future payments, but in today's money.
So what the actuaries do is they calculate something called the expected present value, or EPV. Basically, using a more detailed version of our table, they balance the probability of someone retiring at each specific age against the present-day cost of all their future payments. For a single 60-year-old in our plan, that number works out to be about $13,000.
And this is where you see just how incredibly powerful this tool is. You take that individual value and you multiply it by all 100,000 people in our starting group, and all of a sudden, that smaller cost just balloons into this enormous financial liability of over $1.3 billion. That's the amount of money the company needs to have set aside to make good on its promise.
And you know, this isn't just some niche tool for a corporate pension plan. No way. This exact same logic is the engine that powers some of the biggest financial systems in our society. We're talking life insurance policies and even the gigantic cost projections for huge national programs like Social Security.
But this powerful idea of tracking a population through time isn't just limited to finance. The same basic logic is absolutely critical in the world of public health. You see, while a decrement table tracks exits from a group, a morbidity table tracks health events, things like getting sick, recovering, or becoming disabled.
So instead of asking how many people are going to leave, a morbidity table asks how many people are going to get sick. It's a tool that helps epidemiologists really understand the true burden of a disease on a community, which lets them do things like allocate resources and make smart policy decisions.
Take a look at this. It's a hypothetical table for COVID-19. Just by organizing the data like this, you immediately start to see clear patterns. The rate of new cases, that's the incidence rate. It climbs steadily with age.
But what you really want to look at is that last column, the case fatality rate. When you pull that one piece of data out and put it into a simple bar chart, wow, the story just becomes crystal clear, doesn't it? While the disease affects everyone, the risk of a severe, fatal outcome just skyrockets for that 65 and over group. This is exactly the kind of data that drives vaccination priorities and helps hospitals plan ahead.
These tables are also fantastic for comparing risk between different groups of people. So in this example, tracking diabetes, the data shows that men in this population have both a higher rate of new cases and a higher overall rate of the disease than women. Now, this could point to anything: biological factors, lifestyle differences, maybe even how often each group gets screened.
So, what's the big takeaway here? Well, whether we are talking about a multi-billion-dollar pension plan or a global pandemic, the basic tool is remarkably similar. These simple, structured tables give us a logical way to take a really complex, uncertain future and turn it into manageable, predictable risk.
It really gets you thinking, doesn't it? From the price you pay for insurance to the health warnings you see on the news, all the way up to the budget of an entire nation. What other hidden calculations, laid out in simple tables just like these, are quietly shaping the world all around us?